Back pain. It's one of the leading causes of disability worldwide, and 80% of adults will have back pain at some point in their lives. This Live Well segment is sponsored by HouseFit. Joining me is the owner, Dr. Beth Templin. Welcome back.
Hello, thank you.
So we were talking, I was like, is back pain specific to age? Because my goodness, sometimes my back is just not, it's not well.
Yeah, I mean, the statistic tells us that 80% of people experience it. I've had back pain after a car accident. You told me you've had back pain from tumbling.
Yes.
So it's so common. But the thing is, as you age, it becomes even more common and even more difficult to get rid of.
Yeah.
So we have normal changes in our spine that happen with age. If you've led an inactive lifestyle, if you had a previous injury in your younger years, that can flare up as you get older. Trying to lift something heavy when you're not strong enough, and even simple things like poor posture can contribute to back pain, right? We're sitting up taller
I'm like,
now.
let me sit up straight.
To flare up. And so it just is so much harder to get rid of as you age.
Yeah, well, why is the back so vulnerable to pain?
The back pain is so complex. There you have your core muscles. As you age, you have diseases like degenerative disc disease, spinal stenosis, even arthritis that can all contribute to it. And a lot of the people we see have non-specific back pain, meaning that there's no underlying diagnosis that contributes to it.
So what's the issue with regular treatments?
Yeah, so people go to what they know. They go to, I'm going to do heat, ice, pain pills, chiropractic massage, and then they get no relief, and so they're thinking about injections or even surgery. And while some people get relief, we find that most people don't get that permanent relief, or they're living in fear of flaring that back pain up again, and so it just kind of creates this vicious cycle. This is where something like regenerative therapy can come into play. And at HouseFit, we offer EMTT, radial shockwave, and focus shockwave that allow us to give a different approach to healing the back pain.
Yeah, Dr. Beth, we're looking at some of this right now. What type of therapy is this that they're doing
So this is the radial shockwave. So this is really good for the soft tissue, all of the muscles surrounding. That is the focus shockwave. We can actually target the spinal segments and the facet joints. And then that's our EMTT, which just decreases inflammation across the entire back. It pushes out the pain and it resets the cell to normal. We tell people a healthy cell doesn't send out a pain signal, just a damaged cell does. And our regenerative therapy is healing from the inside out. It heals the tissue from a cellular level, and things like pain pills, injections, and even surgery don't do that.
Wow. So you have a client that's gone through some of your processes.
Yes.
Mary and her daughter.
Yeah, so this is the best story. So Mary came in because she was having back pain.
Yeah.
And she had done all the right things. She was going to chiropractic once a week, but the pain would still come back. She had tried physical therapy in the past. She'd even gotten 3 cortisone injections. And she was looking for,
Wow.
wasn't getting long-term relief. So they were looking for something different. So she was nervous, so her daughter brought her in. And after we did the discussion, turned out her daughter, Darlene, also had some nagging back pain.
Wow.
And so she decided to do the services too. And our protocol is 6 weeks. And at the end of 6 weeks, Mary, who is 93, had 100% pain relief.
Oh my gosh.
And her
100%.
daughter, and her daughter, who wasn't even coming in, 74 years old, had 95% relief after 6 weeks. And we tell people that first 6 weeks is just the loading. Your body will continue to heal itself for another 8 to 12 weeks. And so it's just so exciting that we were able to help both of them get the results they were looking for.
And they got them fast, 100%. That's amazing.
Yes, after years of struggling to do all the right things, and it's so frustrating. You do all the right things, and you're still not getting the results, and so you start to doubt yourself or question if it's ever going to get completely healed. And again, it's so lovely to be able to offer another healing option, especially for somebody who's trying to avoid surgery, because the biggest predictor of needing back surgery is history of a previous back surgery. So you're usually not one and done with those back surgeries.
Dr. Beth, thank you so much. And if you're ready to try an alternative approach to pain pills and steroid injections for your back pain, sign up for a free consultation to speak with therapists about your specific back issues. Visit HouseFitSTL.com. Give them a call for a free consultation at 314-939-1377. And give them a like and follow on Facebook and Instagram.
Thank you.
It's so great to have you, always. Now I gotta keep my posture.